Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. Today I'm here with Dr. DiPaola, and we're talking about back pain. Doctor, is it true that the worst thing for a sore back is bed rest?
There are times where bed rest can be beneficial. Ultimately, it's important to figure out your diagnosis. Why do you have back pain? And the most common reason to have back pain is to strain a muscle. In the past, people used to think you needed to be on bed rest, lay flat, not move till all the pain subsides. But really, we've kind of learned over time that it's better to get active, to get some of the joints moving again, and as long as you've established your diagnosis is not one of the main worrisome kind of issues like a broken bone or a nerve problem, an infection or a tumor. Some real serious things that we think about as surgeons when we see people. If it's not that and it's more of your standard run-of-the-mill strain in your muscle strain, then some rest can be helpful, but there are times where you kind of need to move on, start getting mobile again.
Do pinched nerves always cause severe back pain?
It depends on whether you're experiencing a pinched nerve that you see just on an image. So if you had an MRI and the radiologist says that the nerve is being pinched, oftentimes you'll hear the term stenosis. So you can see it, but it doesn't necessarily have to cause pain because the body is very adaptive, especially the nervous system. And if that quote-unquote pinching happens over time from a degenerative process, so the body can develop bone spurs or bulging in discs that can close down some of the room for the nerves. Oftentimes that doesn't necessarily cause acute pain. It certainly can. So it's within the realm of possibilities, but a pinched nerve doesn't always have to cause severe pain.
If I have back pain and problems when I'm young, will they get worse as I age?
Again, it comes down to understanding your diagnosis. So that's probably the most important thing you should focus on when you're thinking about back pain is why am I having back pain? And when you go to your doctor, you want your doctor to search for that diagnosis and establish that. And what I think about as a surgeon and a patient seeing me is, first off, can I rule out the most important sort of dangerous things or most severe things? So a fracture, a broken bone, an infection, a tumor, a neurologic problem with a nerve, or a spinal cord. If they don't have those things, then we're kind of in a different sort of category, and you need to establish that diagnosis first. And not everybody, and in fact most people, don't have progressive deteriorating problems.
If the doctor didn't find anything wrong with my back, is it just psychological?
I think it's a good thing if the doctor didn't find anything wrong with your back, but again, that you have to put it in context. So what did the doctor do to determine that, quote unquote, nothing's wrong with my back? And let's say you had an MRI and then your doctor said, the MRI looks normal. I'm often sort of faced with that situation where a patient comes to me and they have an MRI and it's essentially age appropriate. For the most part that's good news, but it doesn't negate that you have pain. And there are a number of factors that cause pain, but as a surgeon it's good because I can tell someone, well, I understand you have pain, but at least you don't need surgery because you have anatomy that's appropriate, and we haven't found something sort of very worrisome or that could become a serious problem.
Will an MRI scan always show the cause of back pain?
No. Oftentimes we wind up seeing patients who have either mild or moderate findings or findings that what we consider age appropriate. For instance, there are good studies that show us that about 50% of people over age 50 or even more, it tends to go with your age. But just an example, if you're 50 years old, about 50% of the patients who walk in the room, whether they have symptoms or not, will have changes on their MRI that may be considered abnormal compared to if you were 18 years old. So you can have a normal MRI and have back pain. You can have an abnormal MRI and not have back pain.
Does physical therapy really cure back pain?
Physical therapy can be beneficial for many different reasons. Again, it comes back to what's your diagnosis? Why are you doing therapy? What are the goals of therapy? And I like to express to patients, well, first have them express their goals, but then try and help them understand, what my goal would be for them, and getting usually from a certain stage that they present to a different stage. So perhaps they used to be able to play basketball a couple of weeks ago and all of a sudden now feel bedridden, or are needing a cane where they didn't used to need a cane. So you can look at physical therapy, I think, in terms of an excellent tool to help sort of rebuild the things that I can't rebuild. So I can't rebuild your muscle as a surgeon. And that plays, I'd say, greater than 50% role in the patient's ability to tolerate their activities of daily living. It's something that we often, our patients often underestimate in terms of the importance of what they can do. If you have concern, if your function has changed, if you've looked at your sort of day-to-day activity, and whether you've had a specific episode, which is, it's kind of easy if you've had an injury, you fell off of a ladder, or if you're having illness, fever, weight loss, things like that, those are real red flag kind of signs. But the vast majority of our patients haven't had a single episode or injury. Oftentimes people present with a disc herniation or something that can be incredibly painful, but say, why did this happen? I didn't fall off the roof or have a car accident or something like that. So you got to use your own intuition, knowing yourself better than anyone knows you, and have a good relationship with your doctor. But it's always best to seek care or advice.